Hello, everybody. Good morning. Welcome to this event that we are so happy to share with you today. This is an event organized by the partners of the European Health Data Space project, EDAH. This is an European Innovation Ecosystem project that has been implemented for 2 years already. My name is Montse Daban. I am at BioCat, the bioregion of Catalonia. And I'm happy to welcome you all today here on site and online. Thank you all. And I would also like to introduce my partner in the project, Janusz Pikani.
Yes. Good morning, everybody. I'm representing Scanbalt, which is a meta cluster in health and biotechnology around the Baltic Sea, has been around there already more than 20 years. And we are happy to our endeavors, what we have started 5 years ago on health data space, has been now reached to the maturity level where Parliament has been able to approve the regulation, which is now need to be implemented. And for me and for us, it means actually the process will start, not end. And this means also that it's a sort of good metaphor that we have been hosted today in the Flandern building brand new premises, which are not completed yet. So it means that we are in the start of the path, what will be obviously be not very easy, but very thrilling. So thank you very much. And I hope very fruitful day, and also welcome to everybody who is actually online, because we have a large number of participants online.
Yeah, thank you, Janusz. And I also want to thank the Flemish Government that very graciously offered us the possibility to celebrate this event here today. I'd like to thank Kathleen Dont. She will be speaker later, so we can just thank her again then. And her team, we have in it here also, and all the team that has been supporting us. This is important for us because this project for 2 years has tried to link events organized by this team to member states' presidencies of the EU. Why? Because we think that bringing the dialogue on the European health data space from bottom up, not just top down, it's very important. So we've been building from the ecosystems this dialogue with the stakeholders, with the EU presidencies, and I think we have some good insights to share during the day for that. We also thank all the speakers that also accepted, some of them taking a lot of effort to arrive here. Thank you, Michelle, for being here also today, and Elina, and those that are here today, and Elke. So we will start. We will start with a keynote by Elina Dragvik. She's been one of our colleagues in these developments in the last years, but she's a very relevant member of the EHDS community, both from her role at Sitra in Finland as a senior lead, but also from such big projects like TEDAS. She's been working on TEDAS 1 and TEDAS 2 that will start. Elina, thank you for being here. This is for you too. Okay.
Great, thank you very much, Montse and Janusz, for the introduction. My name is Elina Dragvik, and I'm working as senior lead at Sitra, as Montse has said. So I'm responsible for the secondary use of health data and promoting that in Finland, but also Europe and internationally. In addition to that, I also work on promoting planetary health in Sitra, but also in Europe and internationally. So it's also connected a little bit to the environmental side and how environment and health are in interaction with each other. But to go to my slides, yes, here they are. So I will be speaking today a little bit about the context and what the EHDS will bring to the member states. I will be also mentioning the TEHDAS joint action because it has played an instrumental role in the development of the EHDS. And then I will also provide some insights into Finland's approach and tell some about the lessons learned there. Because this will also provide some food for thought for the panel discussion that will be then discussing best practices after my keynote. And then I will also share some first insights in TEHDAS 2 project that has just started in the beginning of this month. But as you know, there are still many challenges in terms of accessing health data, both nationally, but also especially across borders. The citizens' data is not available when needed, especially for treatment situations and especially in situations accessing cross borders. And data cannot be fully used to advance health policy and especially evidence-based decision making. Or it cannot be fully used for coming up with the innovations regarding development of more effective medicines, treatments, or better interventions in healthcare. As we all know already, there are these different interpretations of the GDPR that is also hampering the use of data in research and innovation. There are also differences in the practices for collecting and processing health data because there are also differences in the national legislations and how these are handled. But we have an answer for all these challenges. We have the EHDS that will come into force, that will enter into force at the end of this year, most likely at the end of this year. And we also have a number of other European Union data-related measures. So in addition to the EHDS, we have these horizontal measures that are related to promoting and sharing data use across different sectors. And also in the EHDS, we have the linkages that are related to Data Act and the Data Governance Act, GDPR, cybersecurity, and so forth. But as we look at the picture, we also notice that it is quite busy picture. It is quite complex picture. And with all these regulations, we know that researchers and innovators are also struggling with understanding the whole pictures and aligning with all these regulations. So we need also concrete tools and solutions to help researchers and innovators get a clearer picture what is required from them and what they need to do. The EU data strategy came in 2020. It also proposes other data spaces than the health-specific data space that the EHDS is. So the aim of the EU data strategy is really to create internal market for data. So allow free flow of data across sectors and countries as much as it is possible, considering the different regulations, with full respect of GDPR, and also provide this horizontal framework for data governance and data access. There are, of course, then specific rules for health data because it is sensitive data. But it's also very promising if we think, especially the cross-sectoral personal data space that can combine the different data sources. For example, mobility-related data, Green Deal, energy sources, because these are also related to our health and relevant in that respect. So the yellow horizontal line there is sort of connecting. It is the individual. It is about the citizen. It is about the patient as well. So the challenge is how we can integrate that data also from the citizens and patients and use that more in the healthcare sector. That will also enable new services and innovations if we are able to use the data more effectively across the different sectors. Because we think in Sitra that data only has value when it is used. And the more it is used, the more it creates value. But then to the EHDS, the four key takeaways from the EHDS is that it really aims to strengthen the rights of individuals in relation to their having greater control over their electronic health data. So the EHDS provides rules for electronic health record systems. It provides rules and mechanisms supporting the secondary use of electronic health data. And it also has this mandatory cross-border infrastructure for primary and secondary use of health data. So My Health at EU for the primary use and health data at EU for the secondary use. So here is the overall timeline for the EHDS and when it starts to apply. This is from the European Commission slide that I borrowed. So the general application is after 2 years entry into force, and this concerns the EHDS governance board. For the other sections, and now I go through the secondary use because that is the focus here. The entry into force in general in secondary use is 4 years after entry into force. And then for the selected categories for genomics, omics, and wellness applications, the transition period is 6 years after entry into force. And then there are also these connections, the third country access and so forth, that is 10 years after entry into force. A few words about TEHDAS, because TEHDAS joint action has really been instrumental in the development of the EHDS. So in TEHDAS joint action that was running between 2021 to 2023, we worked with the member states and the Commission to provide concepts and recommendations and options to promote the secondary use of health data to enable better policymaking, but also to boost research and innovation. And here are sort of the main pillars of the EHDS. So we covered legal and governance aspects, data quality aspects, infrastructure aspects, and tiny bit of capacity building in the form of these country visits. But capacity building was really not in the realm of TEHDAS. But in every conference I have been speaking about EHDS or about digital health, and every conference that I have participated, the capacity building question is always the one that raises a lot of discussion. And when you ask from the companies and researchers, that is also always the topic where there's most need sort of to solve that issue. So I think more resources should be directed to that direction. We are, of course, happy that the Commission has started these efforts in that area as well. There was the capacity building tender some time ago, and a new project has been launched in that respect now. I won't go into detail about the TEHDAS results. There are a lot of reports that were produced, over 30, but you can download and see all the reports that are available on our website, so tehdas.eu, and you can see all the information there. And we are actually using the same website for TEHDAS 2 joint action. It doesn't have a lot of information yet about the new project, but it will be filled with information later on as we proceed. But I do want to mention a few words about the TEHDAS sustainability work, because this is really crucial when we think about the implementation of EHDS and the challenges that we are facing now in member states, but also at the EU level. So in TEHDAS sustainability plan, we propose a framework that integrates 5 dimensions of sustainability. We consider these dimensions really crucial for implementation of EHDS and secondary use of health data. So first, we highlighted the clear legal basis and governance structure that is needed and still needs to be further clarified. Access to quality data. And also here, the capacity and competence questions were discussed. Trust among citizens, professionals and policymakers, and funding and financing. Regarding the trust, we often focus on the trust among citizens. So trust that the data is secure, trust that there won't be any data leakages and so forth. But we think that the trust is really important to have among the overall ecosystem, and have trust to the EHDS system as a whole. Because if it doesn't work, then that really erodes the trust. If there will be very high burden on the data users, that can also erode the trust. So it is really essential to understand this trust, that it's not only about security and health data and the safety aspects related to that, but it's also about the overall trust in the whole system and the legislation. So the framework was used to develop recommendations for action to be taken both at the member states level, but then also at the EU level to address these various sustainability needs. We know that the EU funding, of course, plays a vital role in building this cross-border access to data, but the member states also have a lot of responsibility and need to invest into the national systems to make the data available in the first place. And also we need to understand that the benefits, costs, and resource needs are different for different actors. And we also need different kind of incentives, and we need to understand the motives for the data holders and the data access bodies and data users. We also looked into the costs and fees that are charged by the health data access bodies. There weren't so many countries doing that at the time of the report, so we looked into Finland and France and Denmark. But we noticed that most costs of the data access and that are charged by the health data access bodies, they are the downstream costs of making data available by data holders. So it's the data extraction that costs a lot. Then the fees for the permits and for the secure processing environment are less significant. But this, of course, only applies when you have the system already running and built. So this is not about the costs of creating the whole system. But I want to share some words about Case Finland. We are #1 in the Personalised Health Index. So we are doing well in terms of scale-up funding, data infrastructure. We are doing well also in terms of policy. It is the green line over there. But what we are not doing so well is the personalized technologies. We are lagging behind in terms of the health products and technologies innovation. So we also have something to improve. But we have also been quite successful in many regards in using the health data effectively. And here are some of the cornerstones for the secondary use of data in Finland. So one of the key issues is the personal identity code, because this is key for linking personal information from various registers. Every person in Finland has personal identity code. We also say that we are sort of sitting on a gold mine because we have very rich national data registers with long time series. And in practice, there's almost 100% coverage of Finnish population. There is opt-out principle in secondary use of social and health data, but consent is not required for registry-based research. It is required for surveys and biobank research, but not for registry-based research. There's also high trust on governments and authorities, and there is transparent operation of these. There's also a lot of collaboration and nowadays even more interaction between the different stakeholders. We are a small country, so we know we have to collaborate. There's also high trust on the benefits from research. In general, there's a broad understanding that the research will lead to better healthcare, novel medicines, new innovations, And there's also high trust on data security and data protection. And we have in place the legal basis. We have the Act on Secondary Use of Health and Social Data. So with this act, we also established FinData. FinData is Finland's national permit authority for the secondary use of social and healthcare data. So it permits this data. It does address the collection, linking, pseudonymization, and anonymization of data. And it also offers a secure processing environment, kapseli environment for data analysis. And of course, it also provides help desk services throughout the process. So what has changed since the Act came? Before the Act, there was previously, if you wanted to have the data, you had to go separately and contact separately the different data controllers. But now there's only one application instead of multiple. And FinData links and pseudonymizes the data, and the analysis happens in the secure processing environment. It is kapseli or other. We have at the moment 9 different audited secure processing environments. So you can also choose, based on your research needs, you can also choose another secure processing environment and argue that. But kapseli is sort of the default setting. Just to give you an idea of the different national data controllers, I'm not going to go through all of these. But as said, Finland has very rich registries. So for example, Finnish Institute for Health and Welfare has different kind of disease registers. And also we have the Social Insurance Institution of Finland, Kela, that registers about prescriptions and also social benefits. We have the Statistics Finland that has registers on the cause of death. Finnish Institute of Occupational Health has also data on occupational illnesses, exposure measurements, patient registry, and so forth. From these registries, THL, Finnish Institute for Health and Welfare, and Social Insurance Institution of Finland, these are the most often used registers, so to say, in general. If we look at the statistics of FinData from last year, so the vast majority of the permits, around 90%, were granted for scientific research, then 7% for statistics, and there were only few for development and innovation or planning and reporting duties of an authority. No data permit decisions were taken for education, guidance, and supervision of social and healthcare authority or knowledge management purposes. But always a data utilization plan is required to access the data sets. If we look at the applicants and their backgrounds, this figure is also from last year. It is around 60% almost from the public sector and 35% from the private sector coming. And then we have 7% others, for example, the third sector or individual researchers. FinData has received over 1,000 applications in total since its establishment in April 2020. And in the same period, a total of 870 authority decisions have been made on these applications. And all these issued permits are openly available, so anyone can take a look at those. I think it's also important for the transparency. So how has FinData facilitated the usage of health data? It really provides a sort of one-stop shop for social and healthcare registered data in Finland. It provides equal and extensive access to all these national data controllers' repositories. It also improves data security and data protection of individuals. Because it's an independent permit authority, it has to comply with all the rules and the legislations. And also the data analysis is happening in secure processing environments. And FinData also offers tools and support for clients and data controllers. So it provides guidance and training and material and regulations on data descriptions and permit applications to facilitate also smooth application process. So EHDS versus the Finnish Act on Secondary Use. There are lots of similarities between the two. The Finnish Act has been used as a source of inspiration in the EHDS. And if we think about the implementation, one would think that the implementation of the EHDS should be then easier in Finland compared to many other countries. But there are also some differences between the EHDS and the Finnish Act. There are more data sources listed in the EHDS. There are also more purposes for which electronic health data can be processed for secondary use in the EHDS. There are also more tasks for the health data access bodies in the EHDS, new duties also for the data holders, and there's of course this specific aspect about the cross-border access to data that we haven't covered in the Finnish Act on Secondary Use. So this will mean also updating the Finnish legislation at some point. So some of the lessons learned, it hasn't been only, so to say, smooth sailing or smooth surfing. It takes time and resources to get new things running. A lot of the time, like in surfing, it's about waiting. So in the beginning, it was a lot about waiting, just waiting to get access to the data because the queuing time was pretty long. At worst case scenario, it could take 12, 13 months. And that is, of course, not smooth. But it was only in the beginning. So the first year was a struggle. But I think FinData learned really from that. It was also difficult to hire staff in the beginning. But now things are up and running, and now the queuing time to get access to the data is about 1 to 2 months in simple cases, 4 to 5 months it can be in complex cases. But this, of course, depends very much on the sort of purpose and the data sets that are requested. But with FinData, we have noticed that it is now smoother and faster processing of permits and collation of data from different registers. It is secure use of health and social data. There is this firm legal basis for the collection of national monitoring data, and the knowledge basis has become clearer in this regard, but we also need that the Finnish Act needs updating in light of the EHDS. We also know that it's very important to engage with stakeholders from early on. There was a lot of confusion in the beginning when the new act on the secondary use came. So there was a lot of confusion and also misinterpretation and also not very much clarity what one had to do if you were a researcher or a company. So I think I cannot highlight enough about this importance to engage with stakeholders. And I think same applies also when we think about the implementation of the EHDS. I think it's really important to form a common picture what is needed and what will happen in practice. We also noticed that there are training needs on data literacy for healthcare providers to demonstrate the value of good quality data input for research, so that there's also a connection between the sort of the primary use side and then the secondary use. In Finland, we have had, unfortunately, quite low customer satisfaction levels when it comes to the EHR systems. So I think that is also a key issue to pay attention to. We need user-friendly EHR systems so that the healthcare professionals can do their work, but that the data could be used from a primary use then to the secondary use to benefit research and innovation. I will say a few words about the EDAH 2 project because it's a very exciting project. It has just started. So it started in the beginning of May, so this month, and we have authorities from 30 European countries participating. The total budget is 6 million euros. It's coordinated by Sitra, and the contract management is taken care by EDAH. It will run until the end of 2026. So here is EHDS 2 in brief. The general objectives is about the implementation of secondary use of data in EHDS. It will also develop collaboration because we cannot, of course, do this on our own, and it makes sense to collaborate with the other initiatives that are also active in this field. So the specific objectives are related to discovery and enrichment of data, access to data, enhancing secure processing, engaging with citizens, but also developing collaboration models. So EHDS 2 results, they will be practical guidelines and technical specifications that will help realize the implementation. And these guidelines and technical specifications, these will also feed into the implementing acts that the Commission still has to draft. But all in all, these EHDS 2 results, they will increase preparedness for the EHDS implementation and help with the coordinated implementation of the EHDS. And as a sort of long-term impact, this will help boosting health research and innovation, but also knowledge-based policymaking. It will help with the efficient use of healthcare resources and improved public health and healthcare. Just to give you a little bit more glimpse of what is happening in the different work packages of the EHDS 2. So we have the data discovery work package that Ninke is co-leading with Sweden. We have there the duties related to data discovery, minimum categories of electronic health data and data enrichment tasks. And in access to data, we have the harmonized procedures, good application practice, specifications for data access application systems. And in secure processing, there are duties of data users in secure processing environments, de-identification of data, and technical specifications of common IT infrastructure. And in serving citizens, it's about informing citizens' involvement and empowerment, but also data users' reporting obligations. And in the collaboration models, it's about the common policies on fees and penalties, collaboration with the authorized participants, but also then the third country access and international collaboration guidelines. What is important here and maybe interesting to the different stakeholders is this public consultation, because that is new in EHDS 2. We didn't have that in EHDS 1, but now all the documents that are guidelines or these technical specifications, they will be open for public consultation. So there's an opportunity to provide input there and also see what we are producing and if that is useful. And the first public consultation will be open in January, February next year. So keep your eyes on the tehdas.eu website for more information, at least at that time. But finally, all this work will then lead to optimal implementation of EHDS. But as Janus said in the introduction already, I also think that we are still in the beginning of this journey. So we are just starting the work. There's still a lot to be done. And it's important to have the vision and the aim clear in our head, but it's also important to keep our feet on the ground and being realistic, drafting the concrete national roadmaps, and also at the EU level, thinking about this cross-border collaboration. But I think the EHDS, it is a sort of great initiative because it doesn't disrupt anything, but yet it will change everything. Thank you.
Thank you, Elina. Thank you very much, Elina, for this presentation. I don't know if there are any questions in the room. We don't have time for many, but for some, yes, please.
This meeting is great. How come that you don't see so many, let's say, medical articles with references, with information coming from explanation?
Yeah, thank you for the very good questions. I think for the articles, I'm not sure if you would need to always specify how exactly you got access to the data. So I think we could check how that is expressed sort of in the acknowledgements or which parts. Okay. Yeah, maybe it's used more like internally in Finland, but we are involved. For example, THL is very active in the different kind of public health projects, also internationally in the EU projects, and this data is used there. But yeah, I think we could be also more visible in that regard. We are not very good always promoting ourselves in Finland. Regarding the consent, you can opt out, but it's not really used in Finland. There are very, very few people who use this opportunity. So it's you can do that, but most people don't do that because they see the value in sort of research and using the data again and again for other purposes.
Thank you. Michelle.
That's a difficult question. Now I have to try to memorize that, but I can, for example, say that Ukraine is one of those countries that is not EU member state, but is still participating. But yeah, but we'll see. I mean, it's still Norway, Iceland. Yes, thanks for helping. UK is not participating. They are not. Yeah, we know it's a pity, but it's because they are not allowed to participate. Yes.
Okay. More questions? Yes. A couple questions, and we just go to the next one. Yes. No, it's okay.
Okay. Okay. Thank you. Thank you very much for a great presentation. I definitely welcome the fact that you've emphasized the stakeholder engagement throughout the process to truly build on the solutions that are well tested and can benefit already from the shared trust of stakeholders. So you already emphasized that you will organize public consultations on different work packages and different guidance that would be developed. Do you think also about, I don't know, forums for stakeholders on certain topics that might require different type of expertise and different experts that might have to come to the table? So it would be good to know whether a sort of a more also another way of engagement is envisaged.
Yes, thank you very much for raising this question. Indeed, we are also organizing stakeholder forums at least once a year that will be open for all the stakeholders. You can participate in person or online via the stream. But we will be also, in addition to this annual stakeholder forums, organizing topic-specific workshops. For example, one will be on ethics, one will be on international collaboration. There might be also other topics. We also have in EHDS 2 the so-called focus groups. So these are ad hoc groups that the work packages can organize stakeholder meetings with these focus groups whenever they see that it would be very useful and beneficial consulting the stakeholders and getting their input for specific issues. So absolutely, I think it's really crucial to have the stakeholder perspective throughout the projects and in different sort of forums and discussions that will be taking place.
Thank you very much. This is not the first time we hear this speech from Alina, but it's always inspiring. Thank you very much for what you were sharing with us. And as you know, many questions that can rise, we're always open to just connect and make that happen. So we go to the next session. This is going to be a panel with experts that initially we wanted to talk about sharing experiences, but the panel has been kind of evolving, which is very good because I mean, this is a live thing at the end. So this will be some good experiences, some good practices, but a lot of food for thought. So I'm going to just say thanks again to the partners. We also represent, we didn't mention them all at the beginning with Janus, but as partners of our project, we also have Health Cluster Portugal. So we have the Executive Director of Health Cluster Portugal, Joaquim Cunha. Can you join me here in the stage? Thank you. So he can be also talking about how Portugal is deploying the 2030 strategy for European health data space as well. Yeah, thank you. I would also like to invite here Salvador Capella. Salva, he comes from Barcelona, Barcelona Supercomputing Center, but he's been he's also a director in the Spanish node, the coordinator of the Spanish node of Elixir, which you know this is a large infrastructure for sharing data. He will be talking also about some of the projects that they are leading from there, like they are working on Healthy Cloud or UK, for example. So thank you for that. Michel, he also came from a long trip around Europe because he was yesterday in a panel in Rome and now he's here today. Thank you for that. Michel has been very active during the Swedish presidency of the EU with the e-health agency in Sweden. So he will also share with us all that. We are very sorry because we had to have today here Shini O'Connor. She's from Trinity Dublin, Trinity College in Dublin, but unfortunately she couldn't make it for the flight connections, but we are very happy to have someone in her place also. This is Elke Lieb. I have to say that it was a pleasure meeting Elke yesterday. She represents a non-for-profit organization, Digin Health. We will learn more. She's an international expert in health as well. And finally, actually, I'm very happy also to say that this is me here, but I want to thank also the Council of European Bioregion partners. They have been very instrumental in building all this information for the European health data space in our project. So, and finally, I'm going to call also to the stage Elfie. I just met Elfie a few days ago in Vanguard Initiative, and I was very, interested in the things she has to explain to. So, Elfie, can you please? Oh, that was expected for you. Sorry for that. So, Elfie, she runs a platform, Vito, to connect lifestyle data with clinical data, and she's going to explain a little bit more on how patients are very active on that regard. So what I asked them all today is just make a first short statement on which is their contribution to the European health data space advancement. how are they contributing to the whole story that we're explaining here. So I don't know if probably we can start with Michelle, because I think you have one slide. What is it? Is it okay? Okay. And this way we just jump from the open discussion. I think it might be working, yeah.
Now it's on. Okay. Yes, thank you. If you have my slide, we can maybe go into that pretty soon. So Michelle Silvestri, Swedish eHealth Agency. And I would say that in connection to EHDS, the European Health Data Space, my agency is already the national contact point and also the digital health authority when it comes to primary use. When it comes to secondary use and the health data access body function, the HDAB function, we don't know yet, but we have raised our hands to say that we're ready to take on responsibilities, etc., in connection to that. So we'll see. And actually, I think that there's a government inquiry looking into this and supposed to present a proposal to the Swedish government tomorrow at the latest regarding the Swedish HDAB function, how to organize that. So we're waiting eagerly for that, but we're not sure that the proposal will be public from the beginning, so we'll see. Otherwise, my agency, we've been the competent authority in many of the different EU projects, both regarding primary use, so the earlier Cross eHealth project, joint action, and also now the current extended EHR. And then we also took part in the first TEDAS project, wonderfully coordinated by Sitra. And we will also take part in TEDAS 2, of course, wouldn't miss that. In addition to that, we also are the competent authority for direct grant on national level regarding secondary use in this case. I would also like to say that we're also involved in a Nordic project called VALO, which stands for Value from Nordic Health Data, also in relation to secondary use and also coordinated by Sitra. So that's great. And that's supposed to have a Nordic collaboration for the preparation and hopefully also for the implementation of the EHDS2, so to say, the dimension of EHDS, which relates to secondary use in that case. So actually, as you heard, I've come directly from Rome and the opening of the HIMSS conference there. So yesterday I was there in a session called the Digital Health Advisory Group Europe. And I gave them some breaking news from Sweden, and I'm not sure. So, okay, now we have it already up here. And I was supposed to present the national strategy for e-health or digital health. And I told everyone there that that strategy, the Vision eHealth 2025, as it is called, it's dead, actually. And that woke everyone up a bit, so that's a good thing. And the thing is that I think that the Vision eHealth 2025 is or was an agreement between the Swedish government on one hand, the state, and the regions and the association representing the regions on the other hand. And in Sweden, it's actually the regions, 21 regions all over the country that are directly responsible for healthcare and very autonomously. So they decide how to organize healthcare. They decide also on how to organize digital health, also procurement of electronic health record systems, etc. So that's a good thing in many ways, but it also has fragmented the ecosystem, so to say, on a national level. So now the Swedish government, probably inspired by EHDS and sees a momentum there, decided that no, the vision is dead. Now the government will take a more clear responsibility for the national digital health infrastructure. And so they gave us a government assignment last summer. And this is part of the result of that assignment that you see here on the screen. So, and actually I was leading that assignment. So earlier this spring, I presented to the Minister of Social Affairs in Sweden our final report of 240 pages. I think maybe it's the thickest report that we've produced this far, but it also reflects the complexity of these matters, I think. So what you see up here, hopefully, is what we call the map. And as you see, it's not a geographical map. It's not a map of networking infrastructure, but it's the basic components and structures of in this case, national digital health infrastructure. And you see on the left-hand part, you see up there the users, and you also see a small gray frame with the political level. And those are, of course, important, and also with the different systems and e-services. But then you see the purple colored 2 frames, and that's what we define as the infrastructure. So the left-hand side, the more organizational part of it, which is key in this case, with all the portfolio coordination, legal matters to give advice on that, etc. And then you see the larger frame, which is more of a technical character, with the different areas and the different components necessary for handling and exchanging health data. And this is, of course, for primary use of health data for healthcare, but it's also for secondary use of health data. So we see, for instance, identity, authentication, logging, traceability. You see data handling, processing, like a secure processing environment. You see transformation, which could be anonymization or pseudonymization of health data, etc. So this is the map that we have presented to the Swedish government, and also in connection to that, a roadmap with a timeline of, to start with, 5 years to start implementing this. Real challenges connected to that too, of course. I'll stop there. Thank you.
Well, thank you, Michelle, because for us, for many of us, you presented that in Rome, but for us it's new, and we thank you very much for unveiling this organization of this complexity for Sweden. And I think that Sweden and Finland are definitely practices to share and to follow. So that is very interesting. And I think that I will challenge now Salva to be the next one to speak, because you talked about structure and governance infrastructures, but then we have Salva advocating for the sharing of the federated infrastructures. This is how he's working in different projects. So what is your take here? And if you want to react as well, that'll be nice.
My first reaction is, wow. It's an amazing work. That is, I see many aspects coming together. So we are coming from the research arena, so the ESDS2, where we have been very much using health data, but not coming from healthcare. So ESDS2, ESDS opens the possibility to start seeing healthcare data being systematically made available to for research. But the question is how, and how we can benefit from that opportunity, and what are the challenges? Because here I see a lot of clinical data that, of course, need to be standardized, harmonized, and normalized, and so on to be used. But the other challenges that might look into the dimension of the data. For instance, if we are talking with about genomics, we have seen already in the ESDS2 pilots that the infrastructure that is in place is not enough, because it's not a matter of mobilizing few kilobytes, but it's a question of mobilizing, if needed, that is the other question, gigabytes, terabytes, petabytes of data that have a complexity there. So then we need to understand how we can do that, and whether we can benefit of the work that has been already done. So, and that is where enter the work that we are doing in infrastructures on, for instance, GDI, the European Genomics Data Infrastructure, that is very much looking at that, how we can use in a federated manner genomics data, where we can have this new construct called EDIC, the European Data Infrastructure Consortium, to enable access across Europe without really mobilizing data from the different countries. So we look federated solutions for data sharing, for data access, benefiting from ESDS too, ESDS, the regulation, but also looking at the challenges, because sometimes to do a particular analysis, we might need to put together the data, but that is not possible. Maybe because we cannot mobilize 1 petabyte of data, that will take forever, if you allow me. Also, maybe because the legislation doesn't allow us to move data out of the countries. So we might need to find the ways to do it federated and to see whether it's the same to analyze data in a federated manner compared to centralized. And we're working GDI on that. We have the same approach in UK, that is the European Cancer Images Consortium. Same challenges, but for cancer images and so on and so forth. So we are trying to bring together solutions that are sustainable, that are taken later on by the member states and connected to the development that you were doing here. So I'm very much looking forward to collaborate with many people in the audience that I have recognized some familiar faces.
Thank you, Salva, because you opened another line of discussion here, and I'm sure there are going to be questions after this panel. So keep that in mind that this is going to be an interactive session. So we expect very much your questions regarding that. And then I'm just jumping to Elfie, because now we're talking about sharing. So sharing is caring. Elfie, what do you have to say about what you've learned of these years implementing this We Are, no? It's your project.
Yes, just to sketch what we are doing, we started Vito. We are a research organization and looking at sustainable solutions. So we're looking at sustainable health, and it's about keeping people healthier longer and looking at the determinants of health. And we see that social and lifestyle factors have a huge impact on our health, but they are often not measured or taken up or combined with clinical data to analyze. And it's typically data also that comes from the citizens themselves. So what we have set up is We Are platform to sort of have a citizen-centric approach to data sharing, and especially the data coming from the citizen themselves, to combine it with the big databases and the clinical data that we have and want to use in EHDS. And also have a big stakeholder. So it's about sharing is caring. So we want to build a trust. So it's about involving the citizens, getting them to contribute and share their data, but also involving all the stakeholders in it. So we're basically building a personal data space to connect with the larger European health data space and see how they can interact. Also look at how sort of preventive data can be used in our platform. We have also sort of a mix of primary and secondary use of data, because the preventive health data can be used by the citizen to improve their own health. So they can use apps or recommendations to improve their own health. And they can also share their data for research. So you have a sort of mix of the data that you can either use for primary use to improve your own health or share with others. And to do that, we sort of want to build an ecosystem of trust. So we have a governance layer where we sort of legal and ethically check applications or organizations that seek access to the data. So we can say to people, you can give access to the data, and we already checked if legally and ethically they require they meet standards. So in that way, we try to build trust into the system, offer transparency to citizens, and we see that they want to share data, but they want also transparency and control, and we offer that in this way. And we hope this would nicely connect with the EHDS system that is being set up to also involve really the patient, the citizen, very centrally in this story as well, and have them also contribute quality data.
Thank you, Elfie. And I think this is, again, another layer of complexity, because we are talking about, and Elina showed, all the different types of data that have to be available at the end of the day to really make some decisions for primary. And then we also talked about the access for secondary use. So the regulation is there, not into force, as Michelle usually reminds us. But yeah, I mean, there's all these different kinds of data that also not patients, but citizens are voluntarily providing just to making these decisions or changing the lifestyle or helping the policymakers. And then from there, we go to the different type of stakeholders that have a role there or that can have a say. And then I would like to ask Elke to share the insights she might have from her position. Actually, she represents, like I said, this non-profit organization, but you've been a consultant for the industry and you've been talking to such different number of stakeholders. How you connect everything we're saying so far, which is your take in this story?
Thank you for having me here. To represent Dig in Health, we are a non-profit, as you said, organization consisting of 30 active members, interdisciplinary profiles like economists, managers, researchers, politicians, and also patient organizations. We are based in Germany and have to say, basically, we have to catch up in Germany in terms of digitalization. So my organization is supporting digitalization in healthcare. We are, according to the Bertelsmann Stiftung study, last ranking in Europe for digitalization in health. There are probably for sure different reasons that I do not want to go too much into that. But I'm personally French and German identity, so I came from the greater region, and our organization has different institute, or one institute in Belgium, in Neunatten, and we want to create other institutes because knowing that Germany is in the heart of Europe, having more borders than any other nation in Europe. So we have 9 borders with other countries. So this is a reality for about 30% of territory, 30% of population in Europe, that they live in these about 40% of territories which are border regions with 30 kilometer of distance. So this is the real reality of citizens, and it's also a very important source of identity. So talking about identity, which me as French and German, I live now more longer in France than in Germany for personal, private and family reason. I cross every day the border, and in terms of healthcare, we see now the limits, and this for a while, not only for the pandemic. We have a special framework, policy framework called the Aix-en-Chapelle Treaty. I don't know if you know that, it's specifically between France and Germany. So the framework is there, means that in an experimental paragraph, there is an agreement that for legal requirements, there could be an agreement between, if Berlin and Paris agree that this region can do their own rules. This is in real life a best practice in my region, greater region. As said, we have 40,600 French. They come to Germany to work for every day, so they are insured in Germany but live in France. And there for 20 years already we have hospitals. They do cooperation for treatment, but it's always on a specific indication, on a specific treatment or contract, and always has to say based on personal engagement. And if these persons are not anymore there for any reasons, then the whole thing starts from scratch. Very concretely, like midwives, they cannot go cross border to look after the babies, newborns. The ambulance, the car for ambulance cannot drive with the warning light on the other side. So these are very concrete things that we in the organization and our non-profit organization wants to support with research, with events that we create, and also with a research project we just recently started to go to implement these kind of ecosystem in data, because personally I think really coming from industry, as you said, industry is specifically medtech is small and medium sized, and we think that we can be a leverage when we help startups and innovations based on their data driven products and services to facilitate cross-border. So this is a win-win situation, because companies can then scale up for international. We have all the MDR, the medical device regulation, for instance, which is the same rule for Europe. but we have different healthcare systems, and for a company it's important also to get money out of their solutions. So when we come into a reimbursement, we have a very complex situation, and in these border regions I think we have the opportunity with a common data background and ecosystem to help not only research what we of course need, but also for industry to create real solutions and products for these patients and citizens.
Yeah, thank you, Elke, because you were speaking, and I remember you saying yesterday that medical devices is the second industry after automotive in this cross-regional territory that you have, and that also you are expert, or you've been working on strategies of to go to market for health tech industries. So I was thinking of the diversity of this panel. We have Elke talking about the industrial perspective. We have Elfie giving a voice to patients or citizens that are patients to be at the end of the day. And then we heard Michelle speaking from a policy-making perspective, how a government is tackling this subject, this complex subject. We heard Salva talking about the academia or the infrastructure or the generation of data. And now we have Joaquim. And Joaquim, he will bring another perspective, because from Portugal and being quite connected also to the government and the initiatives, you also are advocating for this data lake that Portugal is also concentrating efforts on. And where is the situation? Which is the situation now? What can you bring to this table now, Joaquim?
Okay, thank you very much. It's a pleasure and an honor to be here and to be involved in this big movement, because I have no doubts that we desperately need to do something related to some changes in what concerns to health. Let me just begin saying where I'm coming from. I'm coming from Health Cluster Portugal. Health Cluster Portugal is a national cluster that brings together what we call the health value chain, comprising the universities, the R&D institutions, the hospitals, the private and the public ones, and of course companies. The great majority are companies. We are 231, I think, members, and we are very committed with innovation in health by one hand, and by other hand, we like to see and promote health as an engine for the development, an engine for the development of the social and economic development. Most of the times we forget that behind that, the first task of health, that is to treat us, there is a big movement, a big cluster that generates jobs, that generates wellness, and with important companies. So we designed some times ago a strategic plan for this decade. And we based this strategy in four agendas. And I think they are obvious. The first one is innovation, how to bring value to the knowledge, how to bring the knowledge from the universities to the companies and to the patients in the end of the day. The second one is industrialization, how to support more and more industrialization, how to attract foreign direct investment. And the other two agendas are obviously digitalization and data. Because the challenge that we have ahead in health, we think that have to be answered by digitalization and data. And so we set up some projects, and I'm trying to reach to your question in this area. One of them is in the value-based for health, because we think it's a new approach that, in my humble opinion, will transform the way healthcare is managed, with an important head-on. It is information, because what you cannot measure, you cannot manage, And as we all agree, sometimes health is managed by the, I don't know if you understand this sign.
It's universal.
Yeah, it's more and less this way. And the amount of money and the importance of this area cannot align on this approach. Another project is that you mentioned the LACOS, the data lake. We started by a bottom-up approach involving the private players, and the idea is now to more and more involve all the hospitals, not only all the hospitals, all the data providers. As you can imagine, it's a difficult task, a very difficult task. And I have to say that this European EHDS initiative, I'd say it's fantastic, because without this, we will still be in the beginning. I don't know if perhaps we can have an opinion that we could go faster, and we could, but it shakes our realities. And what is happening now, in my opinion, is that because we are pushed by this global or European movement. So we think that the secondary use of data,
I think this is very important, Joachim.
it's very important, but
no, but you're opening the question, so
more than important.
No, but let's say that if I may jump very quickly, you represent a cluster organizations. At the end of the day, connect players. We have players from the industry that are really concerned on what is going to happen, which is the participation in the story. That are being consulted, but patients have to be there. They are not visible in the way as they should be. We can talk a little bit later because we have a couple more questions. So I think this is the vision from a cluster organization. We have clusters, national clusters. We represent a regional European cluster. There's a Cancer European Bioregions, 50 clusters. So the role there is really relevant as connectors, and kind of trying to see how we can support the different stakeholders. EIT Health has a role there. So all of us are trying to have a role in this whole picture. May I just move a little, because we will be short in time, because I want to ask you also, what keeps you awake at night? And I asked you that before, so you are preparing this answer for sure. But what keeps you awake at night in this subject? And you, Joachim, you told me that you are concerned about the breadth of transformation that is required at all levels. Are you concerned about that? Do you see a light from what Michelle explained? Probably Michelle can answer you on that regard after your answer.
Of course, there is a light. I don't know if it is too far away.
Or the train coming to you.
Or it is a train.
You don't know. So the transformation, you're supporting the different stakeholders in their visions, and the national, the policymakers have to be aware of what is coming in a couple of years.
Yeah, but you see, in the end of the day, the GDPR is the elephant in the middle of the room. But there is another one. I don't know if it is smaller or it is bigger. It is the economy of data. It is that
is a question.
It is the difficulty that all of us have in talking about these issues. We have some kind of shame talking about money, economy, business. These are words that have difficult to be used in what concerns to health, but they are there, and I think we need a transparent business model in this area, but at least we need to start talking about this. We need to discuss this, and perhaps in the end of the day, we could decide that, okay, there is no business model but let's all be.
I'm sure there is, and there will
Yes,
be.
of course
Yeah.
there is, but
So
let's be.
so we probably will have people in the audience that can share. I know there's some questions online. We will keep them, probably gather them at the end. But let me just ask Michelle, can you answer about the breadth of transformation, because you were pretty much presenting something on that. But also, let me just advance a little bit, because your concern was that there's no way back. You told me there's no way back. We can only do it well, because we can, let me use that word, screw it in such
If we
different
start
manners.
with that, I think that I see that hopefully in a positive way, that this is the direction now according to EHDS, and I think that I'm positively surprised in a way that it's been approved already. I mean, it could take more years and years of negotiations, but in this case, we know that it's there and it will be finally adopted and enter into force this autumn, November probably, as Elina mentioned. But I would say that what really keeps me awake is rather the tricky equation of the ambition of EHDS in this case to facilitate access to health data for primary use and secondary use for different purposes, and the economy is there whether we like it or not. It must be there. And on the other hand, as Elina showed also on one of her slides, to empower the patient, the individual, and also to safeguard and strengthen his or her privacy. And that's a tricky equation. And I think that will be also challenges along the way here, that we will see maybe problems with data breaches, etc. And we need to handle that as soon as possible in the best possible way as well.
Yeah.
Just to connect very briefly to Joachim's concern about the breadth of transformation, I agree with that, and I think that you could see what we need as a stepwise movement. So the lowest level, you could call it digitization. That is in principle that you have a paper form and you make a PDF of it. I mean, that's not very innovative, right? The next step would be digitalization. And the final step, which is really innovative and really improves things, would be digital transformation, and that's difficult, that's hard. So I agree with you that that is one of the challenges in this case.
Yeah, and for
One
this,
of many.
yeah, and for this transformation, if I may jump to Elfie, you need trust. So patient, citizen. Oh, Elke, please, yeah, you can answer, of course. I have my script, but you can change it at any time.
So it's yours? No,
It's okay, of course.
No, Elfie and Elke are so similar, so I didn't hear quite well. I just wanted to join what keeps me awake at night also is the economic model. Industry should not be the bad guy, just have clear rules. We need data for producing and keep on market products. It's not only for bringing them to market, but to keep them on market, to improve quality, to always know how can we improve and is this the best fit or what is changing. So it's very important for all the stakeholders, not only for the money of the business, of the industry. It keeps me awake also. How can we come to a patient-centric and then later on a patient-driven healthcare system, because it should be driven by the patient and not only all around, I think. But what keeps me really awake is the interoperability. In industry, we need to connect to hospitals and other systems, but also in our European level, and this is coming back to borders, cross-border areas or regions. When I consult startups, I ask, where do you host your data? And they say to Amazon Web Service, or they don't know or have no clue. So we should have really some common level of how can we protect this data, but also how can we make it interoperable.
No, thank you, Elke, because then you open also the floor to Elfie, because I think it's very much
very
connected to
similar
that.
what keeps me awake at night is also the interoperability. So when you see what you have all the news reports on ChatGPT and all the magical things it does, and then when you look at the health data, and it's good that we have a framework for sharing the data, but if you look at the quality of the data, it's still so bad. And we're dealing with preventive and sort of citizen generated, that's even worse. But even in clinical settings, there is so little registered in a standardized way. Even standards themselves have different dialects. So it's really about speaking the same language to make it possible to actually do something with the data we are sharing. So that's I think a big challenge. And also, yes, the citizen's role and the patient's role in this. It's been often said, oh, let's not have opt-out or give consent, but that sort of shows a distrust to the patient or the citizen, because we found in our research, patients and citizens alike, they're very willing to share and participate. But if you sort of shield all the data away from them, that generates distrust in them as well. So it's about transparency. It's about showing what you're doing with the data, how it can improve their lives, their families' lives. And then they're very willing to participate. And I think there could be a very important driver in pushing forward innovations and insights in health. So I hope that we can sort of take those things and improve them really.
And that is it is a wonderful thought. But then we go back to Salva, because he told me, yes, I mean, we can have the regulation in place, we can have the knowledge, we can have the technology, we can have everything. But then someone comes and says, no, I'm not gonna allow you to share that. And there's a firewall there. So what is your concern here, Salva?
Yeah, let me let me translate that kind of nightmare into interoperability as well, cultural interoperability,
Exactly.
if you allow me, because we need a change in the way that we see what are the benefits of sharing data, of putting data together to have higher statistical power, to have better insight, understand better the population, and so on and so forth. And the way forward, I agree with you, there is no way. So we will go faster or slower. There is no other way. It's just facilitating the data sharing. It has to do with interoperability. Semantic interoperability, the level of the data, cultural interoperability, and trying to be clear and transparent might be a way to counteract that. Having open standards and mechanisms that people know by default, well, if I structure this standard, these ontologies, and so on and so forth, of course, they are not going to be perfect, but it's much better than having, unstructured data that's 20 years later, you come and say, well, what this data was captured for, why and how, and so on and so forth. So having a minimum standardization will help too.
And after this nightmare, when you wake up in the morning, if you slept at all, when you go to the Barcelona Supercomputing Center, what are you doing there to solve some of those concerns? An example.
So actually, what we are looking is first on the quality of software. Let me introduce the software here, because we tend to think data, and more data, and metadata, but then we tend to forget about software. And software is an essential component. We are coming from the academic world where we are really good at having prototypes and having demos, but we need to scale up and to recognize which software components are needed to mobilize the data and to make sure that is secure, is privacy by design and by default, and these aspects. We need to consider on data and how we develop software and the adoption of a standard. And we need to keep pushing on that. So people are aware of those aspects.
Okay, thank you. And after what you heard in this table or what you saw in the presentations, Joaquin, something that you saw solved now that didn't expect to, like 1 year ago? Is it, for example, many different efforts aligned, already some examples in place in different countries that you can just inspire on?
I mentioned before, I think the most important is this kind of movement that is ongoing, involving all the European countries, and in each country, I think the right partners, and of course this will succeed. The question is how, and how much it will take. I think also related to this, it was mentioned the literacy of the patients and of the citizen. I want to have the literacy of the professionals, the healthcare professionals, because they are key players in this field, and we must look at this data approach from the very beginning. This could not be some dream of the informatic people or lunatic people.
Oh wow!
No,
you have to answer to that.
This is the interest of, as I mentioned in the beginning. I think if we do not make important changes in the way we manage health, these national health systems, as the way we know it now in Europe, will die. It's a question.
And joking, sorry, because we have just a few minutes, but and we just make this round again. But I have one question, or we have one question online. Selkan Turker asks, how will be the process in associated countries regarding national regulations? Can someone here in the panel or in the room answer to that? How it will be for the associated countries? Regarding the text of the EHDS, there will be, as far as I know, some rules for third party sharing, for what I read, but Michelle, Salva, or anyone that is.
If I got the question correctly, it's about so-called third countries. That is countries with outside of the European Union and the EEC in this case. And again, as Elina showed on one of the slides, that will be in the latter part of application of the regulations. So in 10 years after entry into force of the regulation, then EHDS will open up for so-called third countries also to join. And then, of course, they have to fulfill certain requirements to do that, similar to what the member states have to fulfill, so to say.
Perfect. We have like 7-8 more minutes in the panel, so I'd like to go just very quickly ask those that have not shared what they didn't expect to see solved. If you want to just add something on here, so is it something already done that you didn't expect to see it so soon, or you are pretty much following the path of what it is developing? Yeah, Elf.
I think I was very happily surprised to see that we managed to get it through. At some point, it seemed like the discussions would go on for years. So it's good that everybody decided we need to move forward on this, and that there is sort of a common driver towards we need to realize and push forward on sort of sharing the health data. So I think that's a very important one. I think we also cannot underestimate European data strategy and the way they sort of put the citizen and their rights at the center of the data strategy, and not just saying we're just going for the money and whatever. So I think that's a very important set of ideas that we have in Europe that we should not underestimate and really cherish and keep them at the center moving forward as well.
Thank you, Elfie. I remember Salva saying that he didn't expect to see generative AI filling gaps. Is it already happening? Which are the ethical considerations to be taken?
To be honest, I cannot remember.
No, you told me, I wrote it, but anyway.
No, actually, I was thinking that we have the ESDS regulation that will come into force. We will have the AI Act also providing a framework to how data can be used. So now we are giving ourselves instruments to make transparent and more, or having clearance to how data can be used. So generative AI, they are being trained, they are generalized, now they are being fine-tuned for specific domains. We will see then in general applications, that is something to be tested.
Yeah.
We need to understand what is the deep or how that models are working before we start using them routinarily. They can be used and contrast to say a professional will say this, what is the model saying, but I wouldn't trust today
no,
on those.
no, of course.
Models.
You probably just mentioned, but I took it a little bit farther, just to provoke you a little bit.
Exactly.
So, but we have a good friend of ours also online, Tatiana Vorontsova from Rivne Medical Cluster. Hi, Tatiana, by the way. She's saying that listening to us or to the speakers about these open opportunities in Europe for the use of data. So how can Ukraine join this process? Because, you know, the health system has been massively destroyed in certain infrastructures, etc. So, but they're still working and they're still joining projects and everything. So just some words of what's next or could be next for them. Who's daring to say something here? Michelle or Elena, that are the ones that look at the future. I mean, you can join the discussion, Elena, of course. You have all the info as well.
Well, thank you very much. Indeed, I think it was very good sort of also politically that Ukraine was able to join TEHDAS 2. But we also understand that the situation is very difficult there at the moment. But it's important still to think towards the future and what can come out and engage in early stages and be part of the European family, so to say. So I think that is the most important aspect in this regard. As Michelle already mentioned earlier, with regards of the sort of the so-called third countries, there's still a long transition time in terms of how to implement that in practice. So we hope that the situation in Ukraine will get better and they are more equipped then also to participate at this front. But it's important that they are involved already now anyway.
And they are in several projects. We are together in some of them, so we hope for the best on that regard. Thank you, Elena. So I think we have like a few minutes because we started a little bit after 10. So in 1 minute tops, what do you expect to see in 5-10 years? We know from Elena that a little bit we know what to expect, but being a little bit more concrete than just the general picture. Something that you expect in the next 5-10 years. It's a broad range, but anyway, who dares to say something here?
Well, very briefly, it's been mentioned interoperability and data quality, and we must see improvement when it comes to that in 5 years from now. And that's what I expect. And I think that 5 years is a little bit short time span to look at, actually. I think that for Sweden, I would say, I think / hope that Sweden will have implemented EHDS fully in at least 10 years from now. If you look at it on a European level, I would say a couple of decades maybe, and then look at return of investment, because this will cost a lot. It will take time. It will be a bumpy road towards these goals. But again, there's no turning back.
Okay, thank you. Next.
Yeah, I'm ambassador for innovation coming from companies and industry, and specifically medical device are small and medium size. So I expect and I hope really that the innovations that coming from these highly creative and innovative companies can come through really to come to the patient, and that the patient can decide if they adopt it in terms of that the struggles in regulations, interoperability, but also on different healthcare systems, and also the lack of lobbying from small and medium-sized companies. So it's mostly driven of big companies, pharma companies. Now recently, I know more than 25 years in this business, and only the first time last couple of months I was in a congress, pharma meets medical device. So there are joining, and they think it's data driven, it's digitalization driven, because markets are now in danger. And specifically coming back to innovations, that these come through to markets and are not bought and just kept in the desk, just not to endanger existing markets. So really, I think with the common ground of digitalization rules, there will be really a strong movement forward. And this is on a short notice, on 5 to 6 years, if we do well.
Good. Elfie, you want to?
Yes, I'll add to that, because I also hope that innovation will help us to gain more personalized insights or care for people, and shift towards more personalized medicine in keeping people healthier for longer, and making a shift in our healthcare systems that are under a lot of strain right now. So I hope that it's a short period of time indeed, but that we see a change in how we deal with health because of the EHDS.
Thank you.
Maybe just a small adding. I think we can succeed if we think in regions. So this local thing, global and local at the same time, then we can help literacy improvement, because companies will, learning by doing, come together, go the way with the patients and with the doctors and health makers. So I think these regional things is very important.
That's a good point. Thank you, Elke. And now, this side of the table, in existing table.
Let me dream with a new health.
Please.
In the 10 years time, less hospital-centric and more distributed, with, how do I say, with everybody connected and supported, with an operational information systems that support not only the management, but the care.
That's interesting, because that's happening in some countries already. In the Nordics also are leading there, and you see Denmark, they're reducing the number of hospitals and increasing the connectivity. So that's a good dream. And Salva.
May I join your dream, Joaquin? No. So no, I just wanted to say that, but along the same lines, clarity and procedures that allow people to focus on what they know what to do. Researchers to do research, policymakers to do policies, and so on, rather than investing massive amount of time to gain access to the data, to fill in protocol after protocol after protocol. And when they gain access to the data finally after 1 or 2 years, the research idea is old, is not innovative anymore, and so on and so forth. So having that clarity in 5 to 10 years is a really good framework, and has to be federated, has to be regional based. There is no other way.
And I thank you very much for that, because even if nobody asked me, my thoughts for 5-10 years would be clear roles for everybody. So we have the regulation, we know a little bit the text, but everybody's always asking which will be my take, which is the role I will have. A role has to be clear. Business models have to be clear, because this is something that will, at the end of the day, have to be discussed about. And skills to understand all that, literacy to understand all that, and to be more willing to understand the future, what it's bringing. So we open this to some questions, like 2, 3, 4, 5 questions, not a lot, but because we have like 5 minutes, but online or on site. Who wants to react to something? And I'm just looking at you because we talked about the industry. Do you want to share something from the industry side? I'm being very bold, attacking you, stalking you. The mic, we can share the mic, yeah. No, because I think this is a big discussion to keep open.
Yes, I will be speaking later today, so
I know.
You want to cover too much about industry use, but thank you very much for all of this. I think balanced interventions, right? So you are saying there is a lot of potential, but still we are not there yet. And I just wanted to emphasize that still a lot need to be defined in the secondary legislation. And what Salvador just said, we need a clarity at the early stage, right? To not only have a trust of patients and the support of healthcare professionals, but also data holders and users should be confident that the system is fully functioning well to our favor. So maybe just a question to a panel. I don't want to point any of you or the question, but I'm just really interested in, you are talking to different partners at the national level. And I'm really more interested in hearing what people do think about this proposal at the national level, how they see it, where they mainly are concerned about, where they see the potential. I don't know, I know Sweden is quite advanced when it comes to their sort of a forward-looking thinking of how to lay out the life science favorable strategy. Maybe also it would be good to hear what are the the stakeholders, the patients, healthcare professionals are thinking about this proposal at the national level. We hear a lot about what is happening in the in the EU bubble, but what are the views at the national level?
It can be, thank you for the question, and it can be answered from the panel and can be answered from the previous speaker, because you in the TEDAS forum are seeing many of those reactions. So who wants to take this answer? It can be both. Salva, you have the mic, or Michelle, or who wants to answer?
Very short answer. I would say all my contacts with patient representatives, patient organizations, they are very positive and very progressive when it comes to the EHDS proposal and the EHDS regulation. So, and again, perhaps a little bit surprising, I must say, but of course, sometimes some stakeholders, we call it like that, bring up questions about the risks, data privacy, data security. And again, we have to look at that from a preventive point of view, of course, but yeah.
Elina, you want to add something here? Thank you, Michelle.
Yes, thank you very much. I think it's an excellent question and very important one. I was just a while ago in the Finnish Parliament talking to the parliamentarians, and they also asked about the EHDS and what we should do at the national level. There were also industry representatives there, and from the industry side, that we also recognize from Sitra's side is this complexity of the legislation as a whole. So it's not only the EHDS, it's about the legislation at the EU level in general that is quite complex, and it can be burdensome to understand for the different stakeholders. And at the same time, you don't have to follow just one legislative piece, but you have to follow 10, 20 others and how they are impacting your work. So I think that was sort of the main concern voiced out. And for that, I think the many stakeholders were requesting this kind of concrete solutions, how to help with the legislative burden. And for that, I think we could use AI and automation to help with that in the future. I mean, it shouldn't be too difficult in that regard, because we also need to enable the startups and the SMEs to comply with all these regulations. It cannot be so that only the industry and the big players have resources to do that, but we need everyone to come up with the innovations.
Well, thank you both for the answer. Elke.
From a national level, from Germany and France, I know about the Gaia X initiative to have this IT structure ecosystem. It developed further. I was not involved particularly, but in consulting startups, I found that initiatives and found that there's lighthouses from automotive. It was driven by industry, so I think there's money and commitment to drive it. In health, we have it on national level in the area where I live, greater area greater region. There's Luxembourg, Belgium, France, and Germany. It's very much driven by Luxembourg in terms of activities. There are own hubs in France and own hubs in Germany, and I'm hoping that they join still under the Gaia X. There's initiatives like Sphinx coming now up, and they prepare. So there's a lot of activity. Yeah, we will see how it evolves.
And thank you, Elke. And with the activity, unless there's a burning question, I think we should leave that here, because otherwise the next panels will be really late. So thank you for attending this event, this session. Thank you to the panelists for being here. We need an applause for them, because that was very live discussion for everybody. So we have a coffee now. It's going to be, initially it was until 11:30, but it's only like less than 20 minutes. So we will give like 5 minutes more for the coffee. Let's meet here at 11:35 for the keynote speech of Kathleen Dont as well. So thank you very much. See you now. Thank you very much. No, pero te he provocado.
Este se está durmiendo.
Voy a dar un...
Yeah, thank you. Right hand, sorry.
I'm having a problem.
Oh, it's your pen. Yeah. You want me to give this?
Yeah, I will. Just for the moment, I did my stuff already.
Very good.
Very good. You
Yeah.
ran to a panel that you didn't prepare, so that's very good job from you.
Einmal kurz Hallo sagen.
Hallo.
Aber ja, genau, wir haben
Ach
das
so.
mal, genau. Perfekt.
And especially health research. So we have this kind of regular like
Ja, ja.
research that together
Ja.
is research, especially health research, because but maybe there is a summary.
Da kann man eine Antwort haben. Ja, genau.
Yes. Yeah. Yeah. Sure. Yes. Yeah. Because it's also like it's also with the culture.
Ja.
In Finland, we are very small. And yeah. You think it's amazing? Yeah. I think almost like all the parties, they are supporting this regardless of no, not that.
You know,
Yeah.
we were there, I will come to you back.
Okay. It's not very urgent. I can't maybe.
Well, because I gave him the name of Marcus Cayola,
Yeah.
but I think he's very busy because of conferences.
Yeah.
But it would be nice to get someone who could answer.
Yeah.
Because he was the and Finland would be actually added well.
Yeah. I mean, it depends on the timeline. Before a summer holiday, I think I would say yeah, like founding because we are on that. So yeah, so it's yeah.
No, I think he would need it. Yeah.
Right. Because we just started this project and everything.
It has
too. Yeah, and we have deadlines that we Finland. It's not only the deliverables, just really the math process. Like extra work.
Yeah, okay. I mean, we can try with Marcus, but he will probably say.
Yeah.
But I am from EIM.
Yeah. Yeah.
And yeah, we will be also on the youth now.
Yeah.
And I want to say that not before summer, but it would be nice.
Yeah.
Actually, right.
Yeah. Sure. Yeah. Also, it's better.
Yeah, no, it's not now. It's not urgent.
Yeah.
It would be like, but it would be nice.
Yeah, of course. Yeah. Sure. Yeah. Yeah, this is what we do also in the context of data too. So,
Yeah. Yeah, we will look at the
Yeah.
consultation. We were involved in PIDAS 1, but
Yeah.
apparently they couldn't.
no, not in such way. It's more ad hoc, but we don't have like the official stakeholder groups dedicated working as such. There's no sort of official establishment. ad hoc basis and based on the needs. But we definitely expect stakeholders, or at least at some stages and through the consultation and then but then how much do we extra sort of workshops that are sort of specific to and that depends also. But we want to give more because it was very quite strict with EHDS and extra work and it's lead that we can experience this. So we wanted to leave more dust and place. Also other forms. And when yeah, definitely. There will be information also on the website. We have EHDS.eu website. So we are continuing the same websites we had before for this website. We are saving resources. Yeah, for I mean, you can still we have still the like a separate section for EHDS one, but now it's like EHDS 2 is like the main.
Thanks for the presentation.
Yeah, thanks for connecting and yeah, I can definitely.
Yeah, I will come back.
Yeah, you can. You have my contact.
Yeah. Interesting.
Are you? Yeah, me too. I didn't have so much time in the morning. Yeah.
Yeah.
Hello again, everybody. I hope the coffee was fine. There was a lot of things to choose to get some little strength to continue. And also thank you for the attendees online for waiting this time. We will go back again to the main program of this session on European Health Data Space. We will have now actually the host of this event here in the Flemish Government. She is Kathleen Dont. She is the policy advisor at the Department of Economy, Science and Innovation at the Flemish Government. But she has many different hats. I met her at the Vanguard Initiative as well. So we are also colleagues in some projects that we are starting. So I'm very happy to have Kathleen here today to share also some insights, because this is like, we like to remember a side event of the large conference on convergence technologies, on omics, that was held on the 28th and the 29th of this month, yesterday and the day before. It was a huge success of a conference linked to the Belgian Presidency, and we're happy to be a side event of this large conference that probably Kathleen is going to tell us a little bit more about. So Kathleen, the floor is yours. Thank you.
Thank you, Monse. Thank you for giving me the opportunity also to give this presentation and welcome you here also. It's been a most inspiring week, I must say. So I'm looking forward to the outcomes of this. So what I would like to do is to share with you why we started on organizing this meeting and the focus on research and innovation for healthcare. So I want to sketch a little bit what we are doing in Flanders, and then how we came to the meetings and what this meeting as main messages brought. So let me introduce you the region. So I work for the Flemish Government Science Policy. So the Science and Innovation is at autonomous authority of the regions in Belgium. So I can only talk for Flanders, but that doesn't mean that in the rest of Belgium there's nothing ongoing. But so to continue, in Flanders we have almost 60% of the population in Belgium. And for those who are not aware, the language in Flanders is Dutch, not to be mixed up with German, Deutsch. So it's the same in the Netherlands, but there they have an accent. We don't have that. And we are very densely populated on less than half of the surface of Belgium, with a GDP that's connected to the population, of course, about 60% of Belgium almost, and very much oriented to export. Now, the expenditure on R&D is quite important in Flanders. It's amounts over 10 billion euros, so that's 2/3 of the total expenditure on R&D of Belgium. And of this, most part is on the account of the business expenditure. So if you express the expenditure on R&D as a percentage of the GDP, this is now on amounts to almost 3.7%. So the Barcelona norm was to have 3%. So we are very happy that we achieved the goal. So if you look on in comparison on the rest of Europe and even in the world, Flanders is doing quite well. So we are performing second after Korea as far as the global expenditure on R&D goes, and for business expenditure on the third place. So and if you compare to the European levels marked, the average European numbers marked with the arrow. So we are very proud that we achieved this. And if you look then to where our focus domains are, the strengths are, it is really in this area of pharmaceutical connected with the chemical industry, the biotechnology and food chemistry. So this is the strength of this, of where we want to emphasize on, also in the regional strategy, to build on the strengths that are aware in the context of the smart specialization strategies. And if you look into the regional innovation scoreboard, that is the calculation of Europe every year, we are now noted as an innovation leader. And as said, this 3% target that we wanted to achieve in 2024, and it was a government coalition agreement, we achieved this already in 2021. So the goal is, of course, to at least keep it and perhaps even improve on this. Now, this ecosystem on to focus on research and innovation in the area of health is built around 5 universities, the academic centers, which are here listed. It's the Ghent University, Leuven University, the University in Antwerp, in Hasselt, and here in Brussels, the VUB. And connected to that, there are a number of research institutions like VIB, the Flemish Institute for Biotechnology, FITO, the Institute for Technological Research. ILVO is on agricultural research. IMEC, not to forget, a very important institution now and with a prominent place in Europe on nanotechnology. And linked to that, there's also emphasis on incubating startups and with bioincubators and bioaccelerators in those academic centers. We also take account of the ongoing initiatives in Europe and try to link as much as possible to the European research organizations like infrastructures like Elixir, BBMRI. And there's also connected to everything, we try to have this complete value chain approach, also supplying sufficient funding for industry to take things one step further. So there's Vlaio, who gives funding to for innovation to industry. The focus on the spearhead clusters with Medvia spearhead cluster in health industry, food, Flanders Food is in the food industry. The blue cluster is in the area of marine development, very broad. And then Flanders Care is an interesting initiative that we want to strengthen in the next governmental period, at least if it's coming from the administration. It's an interdepartmental initiative to try and link the healthcare sector, the users of innovations, to understand what the needs for innovations are from the healthcare users, whether it are the professionals or patients and citizens, and bring this to the innovators and try to facilitate the uptake also in the healthcare sector of innovative solutions. And the whole ecosystem is also completed with different manners of subsidies in the different levels of the value chain. Yeah, this one comes after. That is the Institute for Tropical Medicine where there's a strong emphasis also on to be included in pandemic preparedness and infectious disease approaches. Now, to build on the strength, as I said, in smart specialization strategy, we also initiated this smart specialization approach with the Vanguard initiative that was, for those that were around yesterday, that was presented there. It's a pilot of on smart health. And the idea is to bring strength from the regions forward and build investable projects with complementary strength in other regions. So in the smart health, we saw as trying to facilitate the development towards personalized and precision medicine, and identified that the areas where this is building on is on data, convergence of technologies, precision and participatory medicine, and skills of the future. And in those domains, we want to build investable projects by bringing strengths from the different regions together. So this is also part of the smart specialization strategy of the region. And that's how we want to continue on this field. But in the same manner, we focus on a lot of those initiatives that are ongoing in Europe, like the partnership on personalized medicine, and in the past, joint programming initiatives on AMR, which is now developing into the partnership on One Health AMR, and then the joint programming initiative on neurodegenerative diseases, which is moving now to the partnership on brain health. We are active in the mission on cancer, the Vanguard initiative I mentioned already. But then also what is very important in the evolution and further towards the future was the initiative participation in 1 Million Genomes project, and linked to that Elixir, where the infrastructure to focusing on the life sciences in general, but also in case of the building of the genome data infrastructure and the development of the goals of the genome of Europe. So the institute that is involved in this is the VIB. So they want to build now the core for life sciences on data to establish the ideas of and building further, giving access to data, and use it in the whole development and for research towards innovation, and giving open for services and so on. So it's the building on all those initiatives that we want to include the different aspects and build further on the agenda. And for that, so this was also a message that came yesterday. We should work cross-policy domains and cross-authority levels, and that's what we also, although I'm speaking for the region, we are in close contact with and collaboration with colleagues from from Wallonia, but also from federal level. Sciensano is a federal research institution, so then we are collaborating here in taking genomics in Belgium further here in public health. So the slides are kindly shared by Mark van den Bulke from Sciensano on their activities. So Mark is the head of the cancer center of Sciensano, and the mission is there to support the cancer policy in Belgium, to lower the burden for society, and do this with an innovation-driven approach, where also the communication and engagement with citizens and patients is very important. So this gives an overview of the different of the organization of the Cancer Center and where they are active in. So there's a large focus on the public health, genomics and cancer, and connecting to the public. There's the Belgian mirror group to bring all the stakeholders at the different levels together to develop the agendas, and link this also to the 1 Million Genomes mirror group, and the development of as said, the genome data infrastructure will be part of it. Now, Sciensano is more in the remit of public health genomics, and there the actions that are taken towards the funding coming from the joint actions in Europe is very important here. So this brings the link from research to implementation also closer. So this gives an overview of the many different projects that Sciensano is involved in, like Can Heal was also presented yesterday, but also the actions to prevent the non-communicable diseases. The 1 million genomes project I mentioned, the genome data infrastructure, and 1 million genomes project. So we try to link the different initiatives at different levels to bring everything forward. Now, this whole ecosystem brought us to the idea to have two presidency meetings to try and capture the messages. Where are we now? Where are we in Europe? And where should we be heading for in the future? So we organized on 14th and 15th of May a meeting on be readiness against pandemics, the future pandemics. So learning lessons first from the maybe it's still ongoing, the COVID pandemic, it's not over yet, but also to frame this in a One Health approach and the needs there, and how we need to address the issues of clinical trials, because this cross-border clinical trials is still a challenge in Europe. But also what is very important and often forgotten in Europe is to have this global approach that is needed. And we had a very interesting contribution from WHO on the global treaty that is in the making, but the very big challenges to realize this. The partnerships in this area are also very important. So there are two partners. So Be Ready is the partnership on pandemic preparedness under preparation now. But there's one also I'm about to start on One Health AMR. And so also from AMR, that's called the silent pandemic, but the aligning the goals of the partnerships, and if needed, also actions in case of a severe pandemic again. We thought it's very important to try to find alignments. And we had then in different parallel sessions, we try to address the different aspects that were in the plenary meetings outlined. So then was discussion, and I'll come back to this in a moment, what the main messages were. The other meeting in the presidency was the meeting that was last Tuesday and yesterday. It was on convergence of technologies and to enable R&I for healthcare of the future. So we had I appreciated the presentations very much to sketch the scene in a way that not only experts understand, but also the people that should bring messages forward, like myself, towards the politicians that need to secure the funding. They need to be convinced that it is important to do this. So there was we have all the settings on the convergence of technologies and the capabilities and the promises it holds to get things further. But also there's a lot of challenges to implement this in a clinical setting. And it's related to costs, but perhaps we can save costs also if we embrace those new technologies. So that was the idea to bring this discussion on. And what is very important and was discussed here in particular is the EHDS, how this will support and hopefully not increase the barriers to share information and data to advance things. And this is not only the clinical data, but also the genome data infrastructure under development. The AI Act is also equally important here. And again, the partnerships that the Commission is supporting very much, these partnerships are in fact aligning the R&I budgets from the member states to work towards these common goals. And here, IHI, the Innovative Health Initiative, where the big industry is an important partner, cannot be ignored. It's very prominent, and we should embrace the role of and the capabilities of what the industry can bring us. The EP permit and the Partnership on Personalized Medicine presented not so much the research agenda, but mainly the innovation agenda. How can we accelerate innovation, and how can we accelerate the uptake in particular of those innovations in the healthcare settings? What are the needs there, and the instruments what are offered to take things further? But of course, all those things are very important, but we need to, we are doing this, in fact, for patients and society and well-being of people. And we heard a very powerful testimony of a patient organization of the importance of sharing information and do it in data solidarity instead of focusing on the need for privacy and protection of the individual. So data solidarity should be a more common knowledge, I think. Yesterday, we delved more deeply into those high-tech technologies like single cell and spatial multiomics. So this was mentioned as one of the top 10 emerging technologies by the World Economic Forum of last year. So this is a very promising technology to understand how signaling in cells is going, and to understand at the single cell level the biological processes. We also had a very nice presentation on the power of digital twins to be, first to develop it, but also to use it in a clinical setting. And this also on AI and how this can be used in medical applications. There was a very good presentation on the power of ATMPs and gene therapy, and the proceedings of pharmacogenomics, and bringing personalized medicine to address the unmet medical needs and prevention in particular. And so the final session then was on the role of regions, embracing the role of the power of innovations from regions, and use the instrument of public procurement, which could really help us to advance one step further and stronger. And so to summarize the messages, what we had from first the pandemics meeting, this is the wrong button. There was a call that, so we still need those meetings on pandemic preparedness. It's still needed. There was a general feeling, and there was even a call to have an annual meeting in the context of presidency. So for those countries that need inspiration. And we need also to proceed in having a European-wide accepted procedure on the regulation and on the regulatory and ethical issues if we are going to multi-centered and cross-border clinical trials. There is also a very urgent need to approach this in a global setting with a global view and have a global agenda, and not only our European agenda. And citizen involvement is, like in any of those domains, very important. The partnerships are there to seize the opportunities and tackle the different challenges. So then they all have their roles on the different levels. Together with the research infrastructures, this is seen as the way forward. And this very similar message came from in general, from the meeting on personalized medicine. But the general idea, and this is not summarized because this was the last message from the meeting yesterday, is that, well, the feeling was we are almost there. We have all the pieces of the puzzle here together, but what we need now to do is do it and go for it, make bold decisions and secure the funding to do this, because this is needed. work across policy domains and across authority levels. And only in this way we can proceed. So the general idea was, well, we are there, but now realize it. So put the pieces of the puzzle together. So thank you.
Thank you, Kathleen, because this is a very nice message to end this presentation. Thank you for that. You were saying that we probably have the feeling that we talk too much and don't go to the action. So, but it's again a very complex setting that we have to deal with, and those initiatives are for sure helping. And how to align the stakeholders is the subject also of next session, next panel. Thank you for this presentation. Now I'm going to introduce you Nienke Schutte. She is a head of EU Health and Information System at Sciensano. She is also dealing with these Belgian Presidency priorities, and she will probably tell us about that, but she will introduce also the panel that she's moderating herself. Nienke, thank you for this contribution to this, creating this event today, but all the collaborations that we had so far.
Thank you so much, Monse. I don't need that. All right, so the next panel is about implementation, because implementation is multidimensional. We heard already several pieces of the puzzle need to be fit together. So policies need to be aligned with and need to be complementary to the European health data space. We heard digital transformation and the appropriate technical infrastructure that are both key requirements before entering the European health data space. And finally, we've also heard about stakeholders. All stakeholders in the health system and also beyond need to be mobilized in order to ensure early buy-in and optimal implementation. So today in the second panel, I will discuss with 4 experts how we move from regulation to implementation through this transformation. So my name is Nienke. Monse already introduced me. I run a unit at Sciensano, which is focusing a lot on innovating and strengthening health information systems and thereby contributing a lot to the creation of the European health data space through multiple European projects. And in this panel, we will highlight implementation through 4 different lenses. So we will have more of the technical lens. We will also discuss the national view. We will have someone representing the regions, because those are sometimes even different stakeholders. And we also have a representative from a more cross-border initiative. And of course, all these people are wearing multiple hats. Some are also data holders. Some are also end users. So we're here with quite a nice panel. And let me introduce to you the panel. First on my list is Andres Metsapoulou, who is a professor at the University of Tartu. Please take your seat in Estonia, and he's also heavily involved in the 1 million genome, beyond 1 million genome, GDI, etc. Next is Michele Calabro, who is a director at EUREGA, which is the reference network for the European, regional, and local health authorities. Then we have Sophie de Broe, who is the scientific director at the data governance ad interim at Sciensano, but was also the leading official of the Health Data Agency that was set up earlier this year in Belgium. And finally, we have Mario Jandrosek, who is the European International Affairs Director at the French Health Data Hub, but also coordinating the pilot study, the Health Data at EU pilot study, that is building and implementing several technical building blocks of the European health data space infrastructure. Thank you so much for joining me in this panel discussion. And I would like to start with you, Mario, actually, because currently you are leading this European project, the Health Data at EU pilot study, that aims to build and pilot this EHDS infrastructure for secondary use. And this project will deliver its outcomes already later this year, in September and also in December, including a proposal for metadata discovery, data quality, security transfer, to really support this cross-border infrastructure. And as it supports this user journey of an end user as a whole through the European health data space, could you share where you have identified the most important challenges when it comes to piloting with the implementation, the several parts of this cross-border infrastructure?
Yes, thanks, Nike, for the invitation, and thanks for everyone for listening. So happy to share a few insights from the project. So just as a reminder, it's a project to pilot the secondary use infrastructure of the European health data space. So it relies heavily on actors that are called health data access bodies. And so the first challenge, of course, is that most of those health data access bodies did not exist yet at the start of the project. So there's differing level of maturity, partly no maturity at all in member states with regards to those central actors in the ecosystem. And at the same time, at the European level, at the European Commission, the central services did not yet exist either, who is supposed to deliver part of the infrastructure. So piloting that infrastructure with part of the actors who are supposed to pilot or to build it up is the first challenge. And so fortunately, the regulation will help us with that. Second challenge, I would say, is that before the European health data space, there were multiple already existing initiatives who are partly competing and partly synergetic with what the European health data space tries to achieve. So, which also means that not all people go towards the same direction. So there's multiple funded projects, partly better funded projects coming through Horizon Europe, Digital Europe, EU for Health, EOSC, and you can continue the list quite in a quite long fashion. But they have also already built partly pilot infrastructures or initiatives that at least provide similar services. So again, the idea is, of course, to build on what is already there, but at the same time, we are really there to pilot what is in the regulation, and so to set the basis for implementation there. And so we can't take up everything which was already piloted previously. But so second challenge is more the already existing compared to what the regulation proposes. Then thirdly, more from within the project, maybe the aspect where we have had most challenges, as was expected, is with the use cases to actually realize some concrete cross-border data uses. And because we realize, as we knew, that the conditions in every country are quite different, so you might have a very detailed protocol for a study needed in one country and a much more basic protocol needed in another. And then for the project team to build a coherent project is actually quite difficult. So those more regulatory challenges that especially cause big delays in time to access data more than actually impede the access are the third challenge. And then the fourth is probably the challenge that can most easily be resolved, that are the technical challenges. So to actually have the infrastructures to share the data, to use the data, and there's already, as I said, a lot existing materials. But so if we sum that up together, is technical aspects are quite easily resolved, and challenges that take more time and more effort are on the legal and regulatory sides and on the stakeholder and change management side. So I think that will be a persisting challenge, especially embarking data holders who sometimes don't see the interest in the European health data space will be the major challenge for implementation going forward.
Thank you, Mario. And I was wondering, what are then, how does this both for countries that are not in your consortium? So what are the next steps for them? Because they're not on this train or boat in this very progressive and ambitious project that you are running currently.
Yeah, so the idea of the pilot was not to set everything up for the long term, but it was to show that we can do it, that we can realize such projects, that we can build first building blocks that will be taken up in the future. So, I mean, we talked a lot about the health DKIP metadata standards, common data application form, etc. All building blocks that we hope will be further refined, further used in the long-term European health data space. But the project as such will end at the end of the year, and there's plenty of space for other countries and actors to jump on board. So there's new initiatives starting at the moment or having started recently. So there's the National Direct Grant project. So we will hear about it, I think, a bit more from the Belgian side, but every European country could apply for funding to set up a health data access body and services at the national level. And there's some coordinating mechanism at European level that we call community of practice to help coordinating a bit the activity of those. Of course, we're still in the learning phase as well, but it's already good to have a starting point. And the second initiative there to mention is the TEDAS2 joint action, where we will work together. And there's, I don't have the exact number of countries in mind, but I see Elena in the room. So it's really a large majority of European countries involved there to prepare the implementation. So to write the common rules that will apply in the European health data space, so a bit more in detail than what is in the regulation. So those two together will be the main drivers of taking up and further refining and implementing at national level. And then there's the multitude of other projects that actually build on certain building blocks of the European health data space work that we've done and others have done. So we can cite the Darwin EU project led by the European Medicines Agency. There's plenty of other initiatives and funding programs that will continue to add effort and contribute to the actual real life implementation of the European health data space.
Yeah, thank you for also providing a bit of an overview of the future outlook of implementation through these different initiatives that are, yeah, sometimes are, or most of them are supported by the Commission. And thank you. And I would like to move actually to Sophie, because you played a pivotal role actually in the setup of the Belgian Health Data Agency that is destined to take up the role as governance as a health data access body under the EHDS in Belgium. And these challenges that are listed by Mario, do they overlap with the challenges that you encountered in the setup of the Health Data Agency here in Belgium?
Yes and no. So in the sense, your first point of relying on actors, health data access bodies that did not exist yet. I think the HDA, Health Data Agency for Belgium, was the health data access body that would look after governance and coordination. So that was set up. And it was actually the fact that it was being set up would bring together lots of existing organizations that will fall under this health data access body. So there's 5 big health organizations in Belgium: KCE, the Ministry of Public Health, Sciensano, FACH, and then RESIF. So they were all having health data. And so the fact that you do set it up brings a lot of energy and existing initiatives together, people who are working on the same things, actually, same hurdles. So that was partially being created. So this non-existing HDAB, at least the Health Data Access Body for Governance and Coordination, was being created. And the other point you immediately set off that was different levels of maturity there as well. We copied the exercise we did at Sciensano, because I used to work before I was the leading official of the HDA. I was also working for Sciensano. And we had started a maturity assessment in Sciensano, just to have a very clear view on what is the maturity of our organization. So really basic, you have a tool with 4 dimensions of interoperability. And for each of those dimensions, you have indicators. And they're like, do you have data stewards in your organization? Do you have a data strategy? Do you have a separate room for using personal data, et cetera, et cetera? So you have this whole instrument. And we did this for Sciensano. We went through a whole exercise of assessing the maturity of organization. And I basically repeated it for the 5 founding organizations of the HDA. So that gives us an immediate good, well, not immediate, it took a year to do it, but it was a very useful exercise, because then each of the organizations had to start thinking in terms of data maturity and realizing also lots of issues they never thought of before. And it was also a learning process, of course, because for many organizations, this was their first data maturity assessment, also for Sciensano. So, and we repeated ours. So ours was then 2 years out of date. Now we had a new one. So I think those 2 things, creating actually the HDAB for coordination, so in the name of the Health Data Agency for Belgium, and starting a maturity assessment, which made things very concrete, really helped in those issues. Services that did not exist, yeah, of course, there's many things that still need to be set up. But because you create a HDA-B for coordination, you start thinking, okay, which other HDA-B do I need? I need a data permit one. I need a one for SPE, a secure processing environment. So you start to think about the next steps. So that's always good to start. And existing initiatives, that's going to be a continuing problem. And there are many people who realize this now. So how can we join the dots? How can we join the dots of all the existing initiatives? And there, I think the HDA, the Health Data Agency for Belgium, which is the coordinating health data access body, can play a role. Should try to connect all these dots where every party tries to contribute to the picture with their own strengths. The ones will be better at infrastructure, the other will be better at standardizing data, the others will be better at networking, etc. So, and that's not only for services, that's also for infrastructure, that's for common data models, etc., etc. Yeah, use cases, of course. But also, you mentioned also the use cases. There again, you could also rely on existing initiatives like Odyssey, you know, the Odyssey network. Even that you could recycle for your own EHDA purposes. Okay, I'm going to stop, otherwise I'll...
No, thank you so much for taking us by the hand through setting up of such a health data access of sort of the Health Data Agency actually had to do a maturity assessment. So you identified some challenges, and connecting the dots is important. But I was wondering, the previous speaker talked about the little bit of the technical challenges that were not really the biggest challenge, but more on the regulatory organizational side. In the previous panel, we also mentioned, I think it was Salvador who mentioned cultural interoperability. Is this actually also that you find in your work that this technical interoperability is not mainly the biggest issue, but more on the regulatory and organizational interoperability where the issues lie? Yeah, it's for you.
It's to me, okay.
It's for you.
Yes, I mean, yes, of course. I mean, what I think is the biggest problem, and we discussed it over coffee earlier with Kathleen and so on, and other people. A lot of the health data are sitting at hospitals and carers and one of the comments I got yesterday, because I was another meeting yesterday, this week was busy, engineer meets physician at Delta, which is a very innovative hospital in Belgium. They say all these people talking about data, health data, they should come to the hospital and look at what we have to do every day and how we have to structure this bloody data. Sorry. So it's a nightmare. And so, and not only it's a nightmare, it's also convincing carers how to do it, the use of it, the added value, and also the time these poor people only have because they have other things to do. So this is, I mean, a lot of the issues we deal with now for health data. Other domains in the private sector, in official statistics, have dealt with 30, 20 years ago. They have dealt with registers, they have dealt with standardization, they have dealt with big data. Now we see it coming up to a big extent, to large, at an enormous speed for health data, with a big delay compared to other sectors. But there are big issues like GDPR, but also the fact that the data sits with the carers, with the hospitals. And so, yeah, these are not people who have time to create official statistics. They haven't been given that role. They are there to look after patients. So how are you going to now install a system where, first of all, they do it automatically as part of their job to immediately register digitally, on a 0-1 basis in a register? Or how are you going to convince them of the added value? And you saw very beautifully yesterday that you can do it. There's this hospital, Delta, they have a group of data scientists. They pick out a department, oncology, radiology, and they do things with the data. And the doctors see the added value and they feel motivated to start structuring the data. So this is where, for the health data, I think is the huge challenge too. Because otherwise we can learn from other sectors. And other sectors have gone through the legal the legal regulations that are missing. In official statistics, they have a code of practice. It's brilliant. Look it up. Official statistics, code of practice. Eurostat has a code of practice. We can learn from this. So these issues are being tackled in other sectors. But health data have these other issues, like the data sits at places where people have other things to do and are facing huge challenges. So this is where I think the biggest challenge lies, actually.
Yeah. Well, it's just something that was already touched upon also in the first panel. So yeah, thank you for highlighting this again. And then maybe moving to Michele, because we already addressed a little bit the direct grants. Yeah? So in many projects that are currently about EHDS implementation, the people at the table, the players at the table are working on national level. And also these recipients of these direct grants that were supposed to support countries in setting up the infrastructure for secondary use, the recipients are on national levels. So how many, as many countries have very autonomous regions, how do you overcome then in the regions these type of barriers when the communication and the resources are mostly sometimes compiled at the national level and addressed at the national authorities? Are there differences in implementation barriers there with regards to the autonomous region? I think it's important to highlight this as well, because also in the previous panel, I think Elke already mentioned that this global approach can be very important. But could you highlight a little bit this from your perspective and the work that you're doing with the local health authorities?
Yeah, thanks a lot for this. Good morning, everybody. I'm Michele from Euriga. We work with regional and local health authorities. And one of the topic is indeed how we can make work digital transformation in different regions in Europe. So I think starting from maybe the last question, so are the kind of barriers different from between like regional and national level? I don't think they are different per se in terms of type of barriers. So, you know, we've heard about, of course, the technical ones, interoperability. We heard about more the, let's say, the organizational one, the change management. So indeed, what's happening in hospitals, which has an impact, of course, on how, you know, data is created and then is shared. I think per se, let's say, the range of challenges are somehow known. What I think it's important to understand with the regional dimension is that indeed they might differ within a country between regions and regions. And of course, there are even within the same countries, very different levels of maybe readiness to tackle them, different awareness level in terms of what needs to be done, different awareness level even on, you know, what the EHDS is and what might mean for them specifically. And that's indeed, if the challenges are more or less the same, I think this additional level it's what makes important to have a better focus, or like always keep an eye on what's happening and what should happen at regional level. Because yeah, we heard, for instance, before from the colleague from Sweden, I believe that, of course, you know, Sweden is an example of a country where there's a high level of competence, you know, that goes at regional level. Many others, you know, Spain, Italy, Belgium as well, and so on. It is a way of fragmentation. So maybe the same challenges will apply and will build in a different way between the different regions in the same country. But at the same time, it can become like a richness dimension. Because at the same time, if you have different challenges, you might even look at like very specific solution or very specific practices that have been already going on for years at the regional level or even local level, depending on how the system is organized, in several locations, you know. So that's, I think, the regional dimension offered is, of course, additional challenge in a way, because you cannot look at the single country and say, all 2021, how many regions have the same issues. But at the same time, you can also see how they could offer from the regional perspective, so from maybe ways to tackle these challenges, a solution maybe to a region that is not in the same country, but could be in another country. So I think we've seen these as a really important element also in the discussion that we had with our members, that maybe, you know, the first learning opportunity, it comes from a similar kind of region in across border. I think we'll be also talking about cross border later. So I think building on this, so building on this balance between, fragmentation and richness of finding ways to look and solve problems. Of course, as you say, the way that also grants and European initiative are structured, which often, involves in the first instance the national level. I think it's important that will have to be shaped, will have to have the space for the regional actors to be a little bit more involved. Of course, we know, because that's the case of several regions that are also, indicated by the national level as direct actors that can beneficiate from these like big European actions. EDAH is an example, but many others for sure. But at the same time, I think this can be further strengthened, because otherwise, in such an important action initiative like the EHDS, we risk losing a little bit of those nuances, and also, very importantly, the close understanding that the regional and local dimension have on all these challenges that we've been talking about. Because maybe, at the regional level, you can have a better understanding indeed on an example of an hospital like the one that was just mentioned by my colleague, and maybe can be replicated in a different setup that can have maybe the same challenges or the same, funding principles. So I think this is the kind of balance between additional difficulties, additional richness can become from the regional dimension that can be better embedded in when we look at European policy implementation and making.
Yeah, so there's this extra step needed of capacity building, increasing awareness, and maybe even the sharing of best practices and providing maybe an infrastructure to do so. All right.
I think so. Yeah, that's the sharing of best practices is fundamental. That's something that we've been doing as Euriga on health data, and there are several other actors that put together regions, EBR, but also many more. That it's a resource that at the European level, I think it would be important to additionally tap in, because we can bridge those gaps.
Thank you, Michele. And then, last but not least, we have Andres here. So you can be regarded actually as an end user in this European health data space, in this discussion, because you're a university professor. But however, you're also very much involved in these large cross-border initiatives, the 1 million genome, beyond 1 million genome, etc., focusing on genomics here in this case. So how can these cross-border infrastructures actually connect and benefit from this European health data space? Is there still a place for them in this new landscape?
Absolutely. Yeah, I'm just coming from 1+ million genome project meeting, like 20 minutes by taxi from here. So basically, I would say that first of all, if our goal in Europe is that all countries, member countries, have the same level and quality of health care, so we have to really share the data. But the bottom line is that we don't have enough data. And since I'm coming from genomics, so I don't have to convince you that every living organism has a genome in it, and genome is actually programming how we are living and how we are looking back at what disease we have. So basically, genome data are not existing in large scale.